touchy subject, so I'm kind of like shaky right now. Okay. Imagine not being able to eat because your mouth and throat are full of raw open sores. Imagine not being able to get out of your bed without your skin literally ripping off and hanging onto your sheets. The pain so unbearable that at times you'd rather give up the fight and die. Imagine being followed by this nasty smell that is caused from oozing blisters that pop on your skin. Sorry. This was my Aunt Carmen's response as I sat next to her in a hospital bed last week in Puerto Rico. The health condition that she has is called pemphigus vulgaris. According to SkinCosmos.com, it's a rare autoimmune disorder that occurs 1 in every 1,000,000 people. This is as PG-13 a picture I can get for you. I want to show you more pictures, but I'm afraid half of you are going to like throw up and like run out the room. It's pretty intense. So that's PG-13 version of that. According to MayoClinic.com, pemphigus vulgaris causes your body to produce antibodies that attack your skin cells and your mucous membranes. So your skin cells would usually be like this, and the antibodies actually make them separate, which causes lesions full of like pus and blood and whatnot to form on your skin. The skin lesions usually drain, ooze, crust, or peel away easily, like I mentioned earlier. If you're laying in your bed, sometimes you can't even wear clothes because all your skin literally just comes off onto your clothes. Lesions located in your mouth as well as other areas of your body. They can be this small, they can be this big. Pemphigus vulgaris is such a severe disease that patients are usually placed in an intensive care unit in hospitals, and they're usually treated as severe burn victims. Today I'm going to talk to you about 2 methods in which pemphigus vulgaris is diagnosed, which are Nikolsky sign and skin lesion biopsies. Let's begin by discussing Nikolsky sign. According to Medline Plus Medical Encyclopedia, Nikolsky sign is a skin finding in which the top layers of the skin slip away from lower layers when slightly rubbed. Usually a doctor would go about this test. They'd use a pencil eraser. They just twist it on your skin. Usually a person with pemphigus vulgaris, the skin's going to come right off. Usually within 3 minutes, the skin's going to form a blister right away.
Click it here with the mouse.
This is the mouse?
Yeah. Go back to it.
Sorry.
Hyperlink.
Can you hyperlink it?
Just copy and paste it and then.
Just go back to slideshow.
Can I look that up?
Just reduce the screen and put it in the URL up top.
Yeah.
It's not going to press Control V.
No, didn't copy. Copy the
Yeah.
copy the placement. Let's go back to the PowerPoint.
You can just go back to the slideshow and go back into it and then click it. Like reset up your slideshow, go through, and then click the
No,
link.
she knows it's not hyperlink.
It's not hyperlink, go ahead.
Oh, she
I
didn't have
didn't
that?
hyperlink it, no.
Oh.
You gotta copy the address here.
I'll do it.
I would cut and paste the address.
Cut and paste.
Yeah.
Sorry.
Okay.
Undo.
Education.
No, you're good.
It's
Paste it.
fine.
Control V. Yeah.
Okay, so you see a blister here. This is a shallow blister of pemphigus. And if you push on it, well, so we're seeing a negative Asbo-Hansen sign because the blister is not extending. But if you push on it, you see this is Nikolsky sign. And basically it's a popped blister, and I mean, the whole point is the skin wouldn't move here if there's no blister because it's nice and attached. But once you have detachment, either in toxic epidermal necrolysis or in pemphigus vulgaris, you see that the skin moves, and that's the Nikolsky sign that I've just demonstrated.
Sorry, pretty like rated R, not cool to see animal. According to the University of Maryland Medical Center, when tested, like you've seen in the video, loose skin slips free and blisters form in minutes after popping that blister. Now that we have discussed Nikolsky sign, we'll move on to skin lesion biopsies. According to Georgetown University Department of Medicine, skin lesion biopsies are defined as the process of removing a portion of skin from a patient for diagnostic examination. SkinCosmos.com states that these skin lesion biopsies show separation in skin cells. There are actually three main types of skin lesion biopsies that we're going to talk about. First is the shave biopsy, second is the punch biopsy, and third is the excisional biopsy. The shave biopsy is pretty much as it sounds. They're just going to shave a little bit of your skin off and then they're going to test it. The second is the punch biopsy, which is used for deeper incisions and a small cylinder of skin is removed. And lastly, the excisional biopsy is when they remove an entire lesion, and you're usually going to need an anesthetic for that because it's pretty painful, as well as stitches. In conclusion, my Aunt Carmen that I mentioned earlier was diagnosed through both of these methods that I have discussed today. Most of you are probably wondering how it's important, even though you may not have an Aunt Carmen like I do. But I informed you today on Nikolsky sign and secondly, skin lesion biopsies, which are two ways that most dermatologists go about diagnosing pretty much any skin disorder, whether it be cancer, which hopefully none of you guys will encounter in your lifetime, or anything simple like that. So yeah, they diagnose any wide span of skin problems that happen to anyone.